Good afternoon. My name is Carmen, and I am a student at Maryville University for the Nurse Practitioner Program. I am here tonight to do to perform a head-to-toe assessment for our class, and he is Elena, who is a classmate who has volunteered to help me here and be my patient. Prior to coming here, Elena has emptied her bladder. He's also wore a gown for me, so we can make it easier, this assessment. I also took her vital signs. I measure her weight and her height. It's all been documented. I also tested her far vision. We did the Snellen test, and her vision is a 20/20. So right now we're going to begin with the head-to-toe assessment. We want to begin with the head and the face. I'm going to begin by inspecting the face, which the head is it's midline, the head is upright, still. It's the head's in the normal cephalics. I don't see any signs of trauma. The skin is pink. It's consistent with her ethnicity. I see it's uniform. No, I don't see any signs of discolorations. I'm gonna now I am going to palpate the skull as well as the scalp. Okay, I don't see any nodules, any bumps, any tumors. Everything looks even. Now I'm gonna palpate also her face, looking also for any signs of trauma or any nodules, and if there's any pain. And is there any pain there?
No.
Okay. So while I'm here, I am going to palpate her sinus. Do you have any pain there?
No.
Okay. And this is mandibular. And also any pain?
No.
Okay. I'm also gonna palpate her TMJ. And I'm gonna ask her to see if it's any, can you open your mouth? Okay. I didn't see any popping, any clicking. And when she closed it, I didn't see any lagging there on the TMJ. Next, we are going to test some cranial nerves, facial cranial nerves, and we want to start with some light sensations. For that, if you can close your eyes, please, and you can tell me if it's what you feel it's sharp or if it's dull. I want to start.
Dull.
This is testing cranial nerve number 5.
Dull. 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 Sharp. Sharp. Sharp.
Okay. And her cranial nerve number 5 is intact. Now I'm going to ask her to do a few facial expressions for me. We're going to be checking cranial nerve number 7 and number 12 at the same time. If you can just shrink, I want to see the evenness. Can you close your eyes tight, real tight? Okay. Can you blow? Have you blown a balloon? Okay. Can you clench your teeth very well? And smile. Okay. And everything looks intact. So now we want to go to the eyes, and I'm looking at the eyelids. I don't see any discharge. So actually, I'm looking at the lashes and the eyelids, and everything looks even. The hair distribution, it's even on both. And I'm gonna check now for the conjunctiva to see if okay, it's nice and pink, no discharges. No, I don't see any nodules. And I want to check for the sclera. Open your eyes, and it looks clear. So now I want to check for the lacrimal apparatus. I'm going to press here to see any tenderness. Okay, and I'm going to check right. The gland sits here on the brow bone, and it feels good. Now we want to feel for pupil reactions to the light. And we're going to do first direct and then consensual. We want to start with the red one, which would mean that when I shine the light where the light is, her pupil will constrict. It did. It did. Now I want to check for concentric, which I'm going to shine the light on this eye, but I want to check on the other eye. Very good. And very good. So now I want to look for a extraocular eye movement, which I'm going to see. I'm going to do. Just going to check cranial number 3, 4, and 6. You're going to just look at the tip of my finger and just follow my finger without moving your head. I want to make sure there's no extra movements on her eyes, trapeziums. And Elena is intact. Her cranial nerve 3, 4, and 6 are intact. Then we want to check for her visual fields. And you want to let me know when do you visualize my hands, okay? I'm checking for peripheral.
No. No. No.
All right. And we want to do just one more thing with we want to do the red reflex. I want to shine the light on her nose, and I want to make sure I see that they're reflecting symmetrically on both pupils. Okay, you can look at my nose. Yeah, I see the light reflects on both pupils there. So now we're going to go with the nose. First, we want to inspect, and the nose is mid-light, symmetrical. Skin color looks normal, just like the rest of the skin. I'm gonna go and shine a light inside. I want to look for inside. So I'm looking for this in the septums. There is no septum deviation. The mucosa is clear. It's pink. There's no signs of trauma. It's midline. I also see the turbinates. I can visualize the middle and just the front turbinate, and it's this patent. And we want to check for patency one more way. I want to ask you to, if you can close and take a deep breath with the other one. Do the same thing with the other one. All right, and that's it. We want to keep going down. We're going to go to the mouth. I'm just going to observe your lips. They're midline, they're symmetric, they're pink, they're moist, and I'm gonna go and look in. If you're gonna open your mouth, I'm gonna see inside. It's pink, it's moist. When you lift up your tongue, I'm gonna look at the floor of the mouth, and it looks moist, pink. I'm going to I'm gonna push the tongue to each side to see is it. First, I'm gonna go to the right. Okay, there's no plaques. Okay, it's nice, moist, even, and pink. Don't see nothing extra there. Now I'm gonna, if you're gonna stick your tongue for me, I just wanna see symmetry when you stick your tongue, and I should not put this away, because I am going to check your, the pharynx area. I'm looking for at the roof of the mouth, which is the hard palate. And it's dome-shaped, pink, moist. I'm also looking in the back. I'm gonna say okay. Checking for her reflex. She's got a gag reflex. The uvula is midline, and the tonsils are in place. And they're about a 1. Now we are going to check at her. Let's see, we did the gag reflex at her ears. They're symmetrical. I don't see any discharge. I don't see any nodules. They are parallel with the eyes. I'm gonna palpate to see if I can feel any nodules, and I am going to pull them to see. Let me know if it hurts. Okay?
No.
Okay. If it'll hurt, it might mean a sign of inflammation, which I don't see any redness there. So now we're gonna go and do the test. We want to test for the. We want to do the Weber test for conduction. And you're gonna tell me when do you hear if it's a one, the other one, or both?
Both.
Okay. And that's the Weber test, which means that she's got conduction, normal conduction on both ears. Now I'm gonna do the Rhine test. I want to do for bone conduction and air conduction, and you can just tell me when you stop hearing it.
No.
And now we're going to do the air conduction.
No.
Okay, which is, it was right, the air conduction, it's about twice the length as the bone conduction, and that is normal. Now I want to go ahead and we're going to do the neck. I'm looking for inspecting, I'm looking for symmetry, midline, I'm looking at the trachea. It's midline. I wanted to palpate the trachea right now. I'm going to sweep it from top to bottom to see if there's any deformations, deviations, and it looks normal. It's moving to the right. I'm moving to the left. While I'm here, I'm checking for any JV distensions, and I don't see anything. I'm gonna palpate them. Okay. Now I'm gonna do the thyroid. I feel her thyroid here. Okay, very good. There's no swelling, no inflammation. It's normal. It's small. I'm going to put my 2 fingers in her cricoid area, and I'm gonna have her swallow. Okay, and it just did what it's supposed to do. When she swallows, the cricoid goes up and then it drops to what it was before. Now we want to check the lymph nodes. We want to start in the front with the preauricular. And it's good. We want to go to the back, to the postauricular. Okay, everything looks good there. Then I'm going to go to the occipital. Okay, now I got tonsillar. Looks good. Submandibular, keep going. Looking for the submandibular. Feeling for some nodes. I'm going to the submental. Okay, now I'm going to do the chain nodes in the front. This superficial cervical. And there's nothing. I'm going to go to the back, which is the also the post-cervical. The post-cervical chain, and there's nothing there. We also check for deep cervical change, which most of the time we cannot hear it. We cannot feel it because it's really deep in there. I'm gonna ask her to see if she can turn it to one side, and there's nothing there, and there's nothing there. I cannot feel it, so it's really deep there, which is a good thing that I cannot feel it. I'm gonna go to the clavicular, which that's a bad area. If anything shows, it's a bad area to have lymph nodes. And I'm gonna go below there now to the infraclavicular, and there's nothing there either. So now I'm gonna do let's see, the neck. I'm gonna do the upper extremities. Actually, while I'm still up there, I'm gonna check for a range of motion for the shoulders. So I'm gonna just put resistance to me. I'm gonna put resistance to stroke your shoulders up. Okay, good. How about I'm gonna do your arms too before we go to the extremities. I'm gonna push down. You put resistance to it, and great. Okay, so those are intact. And then I'm gonna go to the lower extremities, starting with the hands. I'm gonna go first. Skin looks warm, even. There's no bumps. I don't see any discolorations. I'm gonna feel for the joints. All the joints look good. There's no pain. Can you do range of motion? You can do extension, flexion, adduction, and abduction. And okay, everything looks good there. Now we're gonna go to feel pulses. Okay, that looks very good. It's about 2. Okay, that's good. And now we're gonna go to the posterior chest. Just this later. No, easier way. So when looking at the posterior chest, what I'm looking is to see is there's any signs of she's using muscles, secondary muscles to breathe, but see like she's breathing normal, even, symmetrical. So now I'm gonna start by inspecting the skin. I don't see any signs of trauma, any nodules, any bumps, any tumors, any discolorations. So, and now I'm gonna just palpate to see if I feel something that I cannot see. And nope, everything is good. There's any tenderness, any pain?
No.
Okay. I'm gonna look for the CVA tenderness. So that's to check to see if there's any tenderness with the kidneys.
Mhm.
Right here around the 10th, this is about an angle. Right here around the 10th cervical line, and I'm going to percuss and see, anything? No.
No.
No pain. Okay. So now we're gonna go to let's see. I'm going to first I'm going to percuss. Yeah, I'm going to percuss. I'm gonna say 99 every time. I'm gonna put the palm of my hand. Well, check for resonance. Say 99.
99. 99. 99. 99.
Okay.
99.
All right, that's good. That was the tactile fremitus. Wanna check for expansion of the oh, I always forget this one. The diaphragmatic expansion. Diaphragmatic expansion. So I'm gonna start percussing. And I'm gonna go from dullness until I feel the tympanic. I'm gonna put a mark there. The same thing. I'm percussing, and it's gonna go from dullness to it's gonna go from resonance to dullness. So I mark them both. I'm gonna have you take a deep breath. I want to see how much does your diaphragm expands, and I'm gonna go from my last mark that I had. I'm gonna percuss. Okay, it's right there. Okay, and I'm gonna go from dullness to resonance, and it's probably about 4 centimeters different that the diaphragm went up when she held her breath. So that's normal. One more thing I gotta check here is the diaphragmatic excursion. I'm gonna feel around the 10th on the spinal. I'm gonna go on the about at the no, it's not the spinal cord.
Spine.
Huh?
Here's my spine.
So I want to see if she's expanding even and symmetric. So I'm gonna put both of my thumbs together, and I'm gonna ask you to take a deep breath. Okay, and both my fingers move symmetrically along her spine. Okay, and that's normal as well. And now I'm just gonna auscultate, and just take a few deep breaths from me. Good, everything is clear. There's no crepitus, there's no wheezing. Good. Okay. Everything look good there. Now I'm gonna move to the anterior chest, and I'm gonna do the same thing. I'm gonna first so first I'm assessing, I'm looking at the skin and just inspecting and see if there's any deformities, any masses, any sense of trauma. Everything looks normal, even. Now I'm going to palpate for the same thing to see if there's anything. And everything feels good. While I'm here, I'm going to check for your notes. You have some axillary notes. And I'm going to go. And there's nothing there. Now I'm going to listen to your lungs, your lung sounds. I'm gonna go even. Also, there's clear sounds. There's no wheezing, there's no crepitos. Now I'm gonna go to the lateral. So you check for evenness. And everything looks good there now. Now I'm gonna percuss. I want you to say 99.
99, 99, 99, 99, 99, 99,
Okay.
99.
Okay, there's resonance everywhere. This is normal. That's a normal sound. Resonance is a normal sound in the liver. Now I want to check your for your cardiac sounds. I should not put that up. First, I'm gonna palpate and looking for the PMI. I'm gonna go and just palpate right here in the one. Okay, I'm looking for if there's any signs of if there's any palpitations, any thrills. Everything sounds very normal. I feel around this area is the PMI, which is the point of maximal impulse. So it's around this side on the mitral. Okay, I think we're done with that part. Now I'm gonna do let's see your I think we're gonna go to the abdominal area. Do you mind
Yeah.
lay
down.
laying down for me? Yeah. Listen to me. Okay, I'm gonna bring my stethoscope. And I need to, I wanna listen to, now that I have you down there, I'm also gonna listen to your heart. Since I'm gonna be listening to all the arterial sounds there. First I'm gonna listen to your heart. I'm listening for if there's any murmurs. Heart sounds normal. No rubs, there's no gallops, no, everything sounds normal. And now I'm gonna go to the heart sounds. Even though you're laying down, I'm gonna go to the different, there's 5 different heart sounds. First, I'm gonna start on the second intraclavicular space, which we'll listen to for the aortic. It looks clear. We go to move to the left side, second intraclavicular space also for the pulmonic, and now we're gonna go from the second to the third. Still on the left side, and this is going to be the earth point. Going down more, this is going to be number 4 in intraclavicular space, and this is the tricuspid. And now I'm going to go mid-clavicular to the 5th, and that should hear the mitral here. Okay. Now that I have it down there, I'm going to first I want to inspect your stomach. I want to inspect the skin. I don't see any sort of trauma. I don't see any surgery or all surgical sites. I check for pulsations in this area. There's nothing. The skin looks even. It looks warm, smooth, and the color is consistent with Elena's ethnicity. Right now I'm going to do I'm going to do listen for some vowel sounds, arterial vowel sounds, which we're going to start in the middle there, which is the aortic vowel sounds. And I'm going to do that with the bell. Okay. I'm going to go to the renal now. Very good. Iliac, arterial sounds that fits the stomach area. And I'm gonna go one more time, and I'm gonna go feel arterial. Femoral. And when I have my bell out, when I'm supposed to feel your area, your, okay, and the JVD. Yeah, hold your breath, you know, hold your breath. Okay, good. Listen. See, feel it for JVD because it's that I'm supposed to feel it with the bell part. Okay, that sounds good. Okay, and now I'm gonna do some light palpation on the stomach. Just see the whole stomach area, some light palpation. Okay, before I go and do the deep palpation, which I'm gonna do the deep palpation on that side first, to measure the liver. I'm gonna begin from the bottom. I'm gonna percuss, and I'm gonna go from tympanic. Where dullness begins, I'm gonna stop right there. So around right here, and I'm gonna do the same thing coming from the top. Oh, I'm sorry, take a deep breath. It's right there. So go ahead, you can breathe now. Okay. So we have an area here of about, I would say 4 centimeters, which it is normal. Now I'm gonna go and try to feel, I'm gonna percuss for the spleen, and I'm gonna do the same thing, more towards the midline, mid-axillary. And I'm gonna go from tympanic also till I hear some dullness, which is around here. And I'm gonna go also from the mid-axillary. And it's about right here. And now I'm gonna do some deep palpation to feel. So to be able to feel the liver, the spleen, and the kidneys. So I am going to dig really hard. I'm gonna have Lena take a deep breath so I can dig my whole fingers underneath the ribs until I feel the liver, and it's right here. I can feel it right here. And I'm gonna do the same thing with the spleen, and take a deep breath. I'm digging all my fingers. I'm gonna go until underneath the ribs, and I feel the ribs, but I do not feel the spleen, which is a good sign. The spleen should not be felt, because if I can hear the spleen, it'll be it's enlarged. And now I'm just gonna feel the kidneys. I'm gonna go from top and bottom. I'm gonna put my hands underneath there to push towards the front, so both my hands can meet. And I'm gonna do some deep digging there until I find the kidneys. Okay, it's about right this area, and I'm gonna do the other way the same. Okay, some deep palpation there. Good thing that she can feel my bladder. That concludes our abdominal area, and now we want to do. I'm sorry, I didn't hear. I just need to listen to the sounds of the abdomen. I don't think I did.
I think you did.
I did. The sounds of the abdomen, not the arterial, the abdomen, so the stomach. Just didn't do that one. I just want to listen. I'm going to break it in 4 quadrants. So I'm going to start in the right lower quadrant until I hear. I'm going to be auscultating there until I hear the sounds. Okay. Good. And okay, that looks good. I want to help you get up, and we want to go and do now the lower extremities. I want to feel same thing, inspection, everything looks smooth, warmth. There's no signs of trauma. I don't see any signs of masses or tumors. I am going to feel for some pulses here. First, I'm going to go to the front, go to the dorsalis pelvis. Very good. And now I'm going to go to the I forgot tibia, posterior tibia, which is about a 2, and posterior popliteal, and very good, very normal. And now I'm going to do some tendon reflexes. I'm going to go through the popliteal reflexes. I'm going to try to find this. Right. Now I'm gonna do the around the tendon here, the Achilles tendon. I'm gonna grab her for 2. Right. Okay. And I also need to do the reflexes on the hands. I'm gonna do right here on this area. Okay. And I know right here. And one more. All right. And we did the strength on the legs. So I am going to push your legs, and you try to resist. You try to push them up, okay? Up. I'm going to push them down. You try to push them up. Okay. Very good. Come towards me. Very good. Stay strong. So these are reflexes, and I want to do the spinal. I want to get you. I'm going to check for your spine. I'm going to have you look. Actually, try to touch toes as much as you could. We want to look. I want to have a bend to see if there's any concavity, to see if it's concave. But hers is normal. It's even. I'm going to check for the spine. There's no signs of deviation. No signs of her having scoliosis. You can get up now. So, thank you. There's no lateral curvature, which will mean that you will have scoliosis. And that is it. With that concludes our presentation of the head to toe assessment, and thank you very much for volunteering. And that's it.